Hi, I'm Julie Byles, and I'm really happy to be speaking to you today about global health and aging. I just wanted to start by introducing myself in this part of the video, and then I'll switch to another part of the video where I'll share with you some slides and information and discuss some key issues in aging. But just by way of introduction, I'm the Global Innovation Chair in Responsive Transitions in Health and Aging at the University of Newcastle. And I became interested in aging a long time ago, and actually when I was in my 30s. And the thing that interested me was that I was involved in two studies involving older people. One was a Veterans Affairs trial to develop preventive approaches to the care of older people, which ultimately resulted into the introduction of the 75 plus health assessments. And the other project was the Australian Longitudinal Study on Women's Health, which I'm continuing to this day and beyond. And at that time, we commenced recruiting cohorts of women aged in their 20s, their 40s and their 70s. And I decided to have a look at what the situation was for the women in their 70s. And I became fascinated with what those women had to say. So we had a quantitative survey, so tick a lot of boxes, but we also had some room at the end where the women could write what they thought about their lives and what was important to them. And there were 12,432 women in the survey, and more than half of them wrote comments at the end of the survey. So I read all of those comments because I wanted to know what they had to say, and became fascinated with the women's lives, became fascinated with the positive aspects of their lives. So I'd been trained as a medical doctor, and I'd been, I guess, in that I'd been focusing on illness and disability and managing disease, and perhaps people having to go into aged care and needing help and dementia and all of those things which we associated with aging. But what I hadn't concentrated on was all the positive things and all the adaptability and the fantastic lives that women could have. And women were writing about the secrets to aging well, being about being involved in the community and having positive thoughts and remaining connected and engaged. And those secrets are no secret, but they've certainly played out to be effective in the lives of the women. And we followed those women through. And so the ones who were 75 are now turning 100. So they're having their 100, those who have survived, of course, are having their 100th birthday. We're sending them a birthday card. And we've been interviewing them about what's important in their lives as well. So that's been an absolute privilege for an academic to be able to work on a study for that long, to be able to follow one cohort of women through that many years. And of course, it's not one cohort, it was 3 cohorts to begin with, and the ones who were in their 50s are now in their 70s, and the ones who are in their 20s are now in their 40s, and we recruited a new cohort of women in their 20s. So we've continued to take a life course approach to health and aging. So what I learned about aging through following those women is that a lot of that it's about social determinants of health, and you will have learned about social determinants of health, and that a lot of health is more about your circumstances than your genetics. It's about your behaviors, your lifestyle, your resources, your childhood, what life was like for you when you're in utero, what your parents' life was like. And that most problems are social rather than biological. And that certainly plays out in later life. And also, of course, that the early life is the foundation for your later life. So that's all very important. I've been connected nationally through the Australian Association of Gerontology, which if you're interested in aging, I would encourage you to look into and join as a student. It's very small fee to join as a student, but huge benefits. And through that organisation, I'm part of the International Association of Gerontology and Geriatrics. So that links me to the world, and I'm the Australian representative on the World Council. And I'm also part of a sort of smaller but closer international family through the International Longevity Centre Global Alliance, which currently includes 16 countries. And we've been focusing on the human rights of older people and making sure that there's good representation of older people's needs at the level of the UN and WHO. But in these times of COVID have brought us, ironically, even closer together. Even though we can't travel, we certainly can travel the Zoom waves. And so we've been focusing quite a lot on the human rights and the needs of older people during the times of COVID, and helping each other to lobby for those rights and to make sure that they're protected within different countries. So in the next part, so that's a little bit of an introduction to me and why I would want to talk to you about aging and global health. But in the next part, I'm going to share some slides with you with some information on them, and they'll be available on the Blackboard as well. I'm going to talk first, and I'll do them in 3 parts so we don't have one enormous video and you can watch shorter videos. The first one will be about global aging, life expectancy, and healthy life expectancy. The second one will be about the impact of COVID-19. And the third part will be about ageism, and as that as being a very important component of the plan for the decade of healthy aging, which we're now entering, as we sort of try to find a pathway to a better world for people of all ages. So join me on the journey, grab your passport, and let's get into aging and global health. Thank you.